Hello everyone, I'm Ying Yao from Dental Designs, and today we'll be talking about root canal treatments and specifically about why x-rays are very essential when we do any form of root canal treatment. So firstly, let's talk about what exactly a root canal treatment is first. So if I were to give an analogy, it would be something like imagine there's a pipe in your home that is clogged, right? So there's some form of blockage inside the pipe, but the pipe itself is still strong and intact, right? So you can imagine this like a tooth, right? So a tooth is like the pipe, and in the internal surface of the pipe is something like the root canal space in the middle of the tooth, right? So when the pipe is clogged, it's akin to, let's say, if the tooth has a infection within the root canal itself. So if the pipe itself is intact and the tooth itself is intact, rather than just replacing the whole pipe or throwing away the pipe. So similarly, rather than extracting the tooth, you can try to keep the tooth or the pipe, right? And try to clean the internal surface of the tooth, right? So how we do that, like for the pipe, for example, so we want to go inside the internal surface of the pipe to clean out any blockage, clean out the clogs, and seal it up to make sure that it's smooth and to prevent future blockages, right? So similarly for a tooth, we want to keep the tooth, we will need to go into the root canal space in the middle of the tooth to clean out any infection and put a filling material on the inside to prevent future reinfection, right? So before we do any root canal treatment, that's where x-rays come into play, right? So let's say for this particular x-ray, you can see the rightmost tooth here is the one that requires a root canal treatment. And the x-ray, generally, when we look at it, we want to first assess the shape and how many root canals there are within the tooth, because that will dictate, that will guide us in our treatment, in a sense, right? So for this particular case, you can see that for the rightmost tooth here, right in the middle of the tooth, there's this thin black line. So based on the appearance, it seems like there's one single root canal, right? That is fairly straight, and we can trace it more or less down all the way to the end of the tooth, right? And seems like a pretty straightforward case. Right? So as you can see here, on the second X-ray on the right, we place this cleaning instrument into the middle of the tooth, right? So this is how we gauge the length, and this is how we clean the inside of the tooth also. But oftentimes, especially, let's say for this case, when I was doing the root canal, I suspected that possibly there was a second canal. So you can imagine it something like a pipe that along the pipe itself, there's a divergence. So it splits into two separate pathways in that sense, right? And this is especially important for root canals, is that because if there's a divergence or the canal splits into two, we want to make sure that we also detect and adequately clean the separate split so that we can achieve a more thorough disinfection of the root canal system, right? So for this case, I had to take another x-ray, a shift at another view, and true enough, right, you can see that there's a second canal as evidenced by this second thinner white line here, which corresponds to another cleaning instrument that we have, right? Yeah, so oftentimes, especially for lower premolars, right, it can be quite tricky in the sense that they often have multiple or divergent root canals that are quite difficult to detect based on two-dimensional x-ray as we normally take for root canals, right? So that's where sometimes dentists may recommend taking a 3D X-ray. So this is what we call a CBCT, so that we can see the tooth in 3 dimensions, right? And this will look something like this here on the picture on the right, where with a 3D X-ray, we can actually see much more clearly if there is a divergence in the root canal, and we can actually see also at what point the root canal diverges. And all this just helps to make the treatment a bit more predictable and a bit more straightforward, in the sense, because we are going in knowing exactly what to expect already, right? So ultimately, at the end of the day, X-rays, whether it be a 2 dimensional X-ray like this one over here, or a 3D X-ray that we may take, everything boils down to making sure that we provide the best treatment possible for our patients. Right. Okay, Ken, so to wrap it up, I think that's just essentially a small case about showing how X-rays in root canal treatments, whether it be a 2 dimensional X-ray or a 3D X-ray, really does help to guide treatment and allows us to provide a more comprehensive and well-rounded treatment for our patients. Okay, thank you.